What does BP mean? What does blood pressure mean? Blood pressure is defined as the indicator of the strength of the heart to pump blood through blood vessels. Blood pressure is one of the important indicators that give an impression of overall health, and the high or low blood pressure may be a sign of a health problem. This can be explained more clearly by explaining that systolic blood pressure reflects pressure on the walls of blood vessels during the contraction of the heart to pump blood, and diastolic blood pressure reflects the pressure on the walls of blood vessels during the dilation of the heart, i.e. between each contraction and other. And to understand blood pressure more clearly, the following example can be struck. If the blood pressure is 117/80, the systolic blood pressure is equal to 117, while the diastolic blood pressure is equal to 80, measured in mmHg. Hg. High systolic or diastolic blood pressure indicates that the heart is exerting more effort to pump blood, giving the impression that there is a factor or cause, may be internal or external. Two types of BP. Number 1. High blood pressure. High blood pressure is also known as hypertension. Blood pressure is the amount of force exerted against the walls of the arteries as blood flows through them. Image result for explain high blood pressure when your systolic pressure is between 120 and 129 mmHg and your diastolic pressure is less than 80 mmHg. It means you have elevated blood pressure. Although these numbers aren't technically considered high blood pressure, you've moved out of the normal range. Number 2. Low blood pressure. Hypotension is the medical term for low blood pressure, less than 90/60. A blood pressure reading appears as two numbers. The first and higher of the two is a measure of systolic pressure, or the pressure in the arteries when the heart beats and fills them with blood. Symptoms of high blood pressure, hypertension. Symptoms of high blood pressure, hypertension, may appear after exposure to many factors that may cause it and after accumulation of their complications. In other words, hypertension may occur suddenly and without obvious symptoms, so it is important to avoid the factors that may cause it and identify its initial symptoms. Symptoms of hypertension. Recurrent headaches is one of the most important symptoms of hypertension. Vertigo and dizziness, irregular heartbeat, and nausea and vomit. A severe headache in the back of the head. Severe fatigue, general debility, weakness, exhaustion, and laziness. A persistent stress, a difficult in controlling the body and inability to carry it and persistent hands tremor. Frequent tinnitus, a shortness of breath and difficulty breathing. Bleeding from the nose, a blurred vision. Urinary tract infection, feeling burning while urination. Symptoms of low blood pressure, hypotension. Low blood pressure, hypotension, may be normal in some people and asymptomatic, does not cause any symptoms. In some patients, it may indicate a particular problem, especially if the hypotension occurs suddenly or accompanied by symptoms. These symptoms appear as a result of low blood flow to the body organs, and the symptoms vary according to the affected organ. Symptoms of hypotension. 1. Dizziness or vertigo. 2. Fainting. 3. Fatigue and general debility. 4. Shortness of breath, and may be accompanied by chest pain. 5. Nausea. 6. Loss of concentration. Normal blood pressure. Blood flows in all body blood vessels, carrying oxygen and nutrients to various cells and tissues of the body. The term blood pressure is used to express the force that blood affects the walls of blood vessels during the pumping of the heart and running through them. Blood pressure in human body varies during the day and night. It may increase during physical exertion and decrease during rest, due to the body's need for greater amounts of oxygen during a physical effort to be able to complete the metabolism natural.